Ibuprofen use and the COVID-19 pandemic. What pharmacists know now. This presentation will answer the question, does ibuprofen worsen COVID-19 infection? My name is Doson Chua. I'm a clinical pharmacy specialist in cardiology at St. Paul's Hospital, Providence Healthcare in Vancouver, BC, and a clinical professor in the Faculty of Pharmaceutical Science at the University of British Columbia. This presentation is brought to you by the Canadian Society of Hospital Pharmacists, BC branch. COVID-19 infection is a worldwide pandemic and a very rapidly evolving situation. There's currently very little research on COVID-19 treatments, and there are very many speculative therapies. The information provided is based on available facts and evidence at the time, but new information is very rapidly released on a daily basis. There's much discussion on social media regarding the use of ibuprofen in COVID-19 infections. This presentation will answer 1. Does ibuprofen increase the risk for COVID-19 infections? And 2. Should patients stop taking ibuprofen due to the COVID-19 pandemic? Ibuprofen, also known as Advil, belongs to a class of medications known as non-steroidal anti-inflammatory drugs, or also NSAIDs. NSAIDs are commonly used to treat inflammation and pain. Some other examples of NSAIDs include naproxen and indomethacin, also known as Aleve or Indocid. The link between ibuprofen and COVID-19 infection is based on the understanding that the COVID-19 virus can enter normal, healthy host cells by the receptor known as the ACE2 receptor. Theoretically, having more ACE2 receptors can facilitate COVID-19 infection by having more pathways to infect healthy host cells. The link was first described in a letter in the medical journal Lancet Respiratory Medicine on March 11, 2020. The authors looked at published cases of COVID-19 infections and observed that a lot of patients with COVID-19 infection also had diabetes and high blood pressure. As well, these patients were treated with medications known as ACE inhibitors and ARBs. ACE and ARBs are thought to increase the number of ACE2 receptors in the body. Thus, the authors hypothesized that the use of certain medications, such as ACE inhibitors or ARBs, could increase the risk of COVID-19 infections. The authors did not present any data to support this hypothesis. The authors of this letter further went on to state that ACE2 can be increased by ibuprofen. Again, there is no data presented to support this hypothesis. Based on this preliminary letter, the French minister, Dr. Olivier Véran, tweeted on March 14, 2020, that taking anti-inflammatory medications, ibuprofen, could be a factor in worsening infection. If you have a fever, take paracetamol, also known as acetaminophen or Tylenol in North America. If you are already on anti-inflammatory drugs or in doubt, ask your doctor for advice. From this tweet, the concern regarding ibuprofen use and COVID-19 infection was spread through social media and made news headlines. Several news agencies initially promoted avoiding ibuprofen, but a few days later, some news agencies disputed the warning about ibuprofen. On March 18, 2020, WHO posted a statement regarding ibuprofen use. Their position is, at present, based on currently available information, the World Health Organization does not recommend against the use of ibuprofen. On March 20th, Health Canada posted a similar statement, stating that there is no scientific evidence that ibuprofen worsens COVID-19 symptoms. Other professional and regulatory organizations, such as the US FDA, Food and Drug Administration, the European Medicines Association, or EMA, and the Canadian Pharmacists Association, also posted statements, similarly stating that there is no scientific data to say that ibuprofen increases or worsens COVID-19 infections. So, does taking ibuprofen increase the risk of COVID-19 infections? To date, there's no published scientific research to support this. Currently, ibuprofen use and the link to COVID-19 infections is just a hypothesis and speculation. So, should I avoid ibuprofen during the COVID-19 pandemic? First, acetaminophen or Tylenol is the first-line drug used to treat fever due to an infection. So use acetaminophen first for treating symptoms of fever. Secondly, use ibuprofen only if you have another medical condition that requires you to take ibuprofen. Finally, if you are worried, talk to your doctor or pharmacist. You can keep up to date on this topic and the evolving COVID-19 pandemic from the Health Canada COVID-19 website. Thank you.